Welcome back to Hardball. Democratic Congressman Rep Grayson of Florida said this about the Republican health care plan. Let's listen.
If you get sick in America, this is what the Republicans want you to do. If you get sick, America, the Republican health care plan is this. Die quickly. That's right. The Republicans want you to die quickly if you get sick.
Well, Republicans demanded an apology for that, and today the Republican Tom Price of Georgia drafted a resolution of disapproval of what you just heard, just like Democrats did for Joe Wilson, who didn't move forward with it. They didn't move forward with that resolution today. And just today on the floor, Congressman Grayson said this. I don't think this is actually an apology. Let's listen.
I'm not going to recount every single thing that I said, but I will point out that immediately after that speech, several Republicans asked me to apologize. Well, I would like to apologize. I would like to apologize to the dead. And here's why. According to this study, health insurance and mortality in U.S. adults, which was published 2 weeks ago, 44,789 Americans die every year because they have no health insurance. So I call upon the Democratic members of the House, I call upon the Republican members of the House, I call upon all of us to do our jobs for the sake of America, for the sake of those dying people and their families. I apologize to the dead and their families that we haven't voted sooner to end this Holocaust in America.
That's what you call chutzpah. Joining me now is Congresswoman Debbie Wasserman Schultz of Florida and U.S. Congressman Dan Lungren of California. Did I get the word right? I think it is chutzpah. I mean, that guy was asked to apologize, Congresswoman, and he came out and told them, so's your old man, I got a bigger charge to make. You're killing people by the millions. Your thoughts?
If you know Rep Grayson, chutzpah is absolutely, and you pronounced it right, absolutely what he has. He has a real dry sense of humor. I know he's been on this show before. I think both his comments yesterday and today, somewhat tongue-in-cheek, maybe a little bit more teeth than tongue, but at the end of the day, he was making a larger point that the Republicans had years to make health care reform a priority. They never did. They have no plan. It's been more than 100 days since Roy Blunt, my colleague in the Congress, they're one of their leaders on and point men on health care reform, said they would have a plan. They still don't have one, and yet every year 45,000 Americans die because they don't have health insurance. And that's the larger point that Congressman Grayson was trying to make. He may have inartfully made it, but it was certainly important to stress that we need to get the Republicans to the table, work with us, sit down, and make health care reform a priority instead of continuing to be the party of no.
Take your time now, Congressman Lungren. You have a lot to bite off of right now. What the Congresswoman just said, what Grayson just said in his, well, doubling down, you might say, his attack on your party. Is this like what happened with Joe Wilson, the Republican Joe Wilson, who said to the president in joint session out loud, "You lie"? Is what Congressman Grayson said about the killing fields of the Republican health care plan, is that the same misdemeanor or felony?
I appreciate very much having me on. I must say that I thought I was going to be on with a congresswoman. I didn't know I was going to be on with a senator who manages to filibuster and not answer the question. Look, the fact of the matter is he said something he shouldn't have said on the floor. He should apologize, just as my friend Joe Wilson said something he shouldn't have said on the floor, and then he immediately apologized, calling the White House, talking with Rahm Emanuel.
He didn't apologize on the floor.
Let's just go and do that sort of thing. The other thing is this. We keep hearing this nonsense that only the Democrats have the wisdom that could possibly deal with health care. We have multiple proposals that have been out there for a long period of time. There are at least 32 separate amendments that were offered in committee by Republicans. Every one of them voted down by the Democrats. The fact of the matter is the American people are rejecting their overall proposal. The American people by large numbers are saying, why not sit down at the table, Republicans and Democrats, and work incrementally on those specific areas that are problems, rather than tossing overboard our entire system and moving towards a government takeover of health care.
Let's take a look.
That's what we're really talking about.
Let's get to that in a minute, but let's take a look at three Republicans. Here's Republican Congresswoman Ginny Brown-Waite of Florida on health care. Let's listen to her, because I think the tenor of this debate has gone south negatively.
Mr. Speaker, last week, Democrats released a health care bill which essentially said to America's seniors, drop dead.
And here's Republican Congressman Paul Brown of Florida.
This program of government option that's being touted as being this panacea, the savior of allowing people to have quality health care at an affordable price, is going to kill people.
And here's Republican Congresswoman Virginia Foxx on health care.
Republicans have a better solution. It won't put the government in charge of people's health care, that will make sure we bring down the cost of health care for all Americans, and that ensures affordable access for all Americans, and is pro-life because it will not put seniors in a position of being put to death by their government.
Congresswoman, three Republicans in a row used language which sounds to me exactly like Grayson's language about the other side trying to kill people. I don't see the distinction. You first, then Congressman Lungren.
Well, it is always fun to debate my good friend Dan Lungren. We just came from a Judiciary Committee meeting together, but you know, I'm glad to see that Dan is really arguing the larger point as opposed to you're going tit for tat over the speech thing here.
But see, I want to argue the smaller points.
I know you really want to do that.
I want to get you both in the gutter and start throwing mud at each other. No, what I really want to know is there anything that's out of line? The old rules of the House when I worked for you people up there in the old days was you didn't get personal. You didn't accuse the other person of being evil.
Chris,
you could say anything you want about policy. Go ahead. I'm sorry.
No, it's okay. One thing I can tell you is that there is absolutely no comparison between Alan Grayson's speech and his comments that were, you know, in the normal course of debate on the House floor than to Joe Wilson's inappropriate conduct that was a violation of the decorum of the House when he shouted "You lie" to the President of the United States during a joint address to the nation. So, putting that aside, though, the larger point that Alan was making was that the Republicans have simply been nowhere on the issue of health care reform except to be critical, except to offer nothing constructive to the debate. And what we need to do is have them, and Dan, I'll meet you anywhere, anytime. I'd love to sit down and talk to you about the common ground that I know we have on health care reform, and stop arguing about the word choices that we use. We need to turn the volume down.
Hey, Chris,
well, Congressman, I love the idea of a deal. How would you, I want you to decide.
Respond a little bit, though, about this
If you
idea.
want to respond, but I got a better idea. Why don't you tell me what a deal would be that both sides would agree to, possibly? Is there a deal in your mind's eye that both sides could get 51% for or 65% for?
Well, I think you would find a majority of the Congress, both in the House and the Senate, saying set aside this idea of public option and let's work on the very specifics that are necessary out there. Number one. Number two, I think we could sit down and we could talk about how many are the hardcore uninsured in this country. Why are they that way? Let us work to do something on that. I would hope we could get agreement that we could allow people to purchase policies across state lines which would allow a multiplicity of plans that would be available. I would hope we could talk about health associations. I hope that we could talk about exchanges that actually mean something where we could get agreement so that you could have greater opportunity for people, particularly those who are employed by small and medium-sized businesses. Those are proposals that have been out there in detail by Republicans for a long period of time. Every single one of them has been rejected, even though offered or attempted to be offered.
We have to go. I thank you, Congressman. We have to go. Debbie Wasserman Schultz, as always, thank you, Congressman Dan Lungren. We can do this all hour. We're not going to do it.